fantastic Thursday morning, the 12th of June 2025, and the time is clocked 6 minutes past the hour of 10 o'clock. Greetings to you, the GIC viewers and listeners within and beyond the borders of the Republic of Namibia, and a very warm welcome to your Thursday morning edition of the Cabinet Committee briefing session. As always, we are coming to you live from the Government Information Center studio. Now for this morning, I am happy to be bringing you yet another Cabinet Decisions briefing, and I'm joined in the studio by the Minister of Health and Social Service, Dr. Esperance Lovinto. But as is the norm, I would like to pause here and extend a warm invitation to you, Namibia, to be part of this discussion or statement, and post your questions and statements in our social media platforms, on both our social media platforms where we are currently streaming the show live. On Facebook, we are at Ministry of Information and Communications Technology, or alternatively, you can stream us live on our YouTube channel. And if you're just wondering, this is a Cabinet Committee briefing session, which is a national platform initiated by the Government of the Republic of Namibia, emanating from the Government Communication Strategy approved by Cabinet and implemented by the Ministry of ICT. Now, this platform is initiated to serve as a conduit for transmitting information on government projects, programs, policy formulations and advancement, but also Cabinet decisions that were made in Cabinet, and of course, bringing you updates and focus from the respective ministries, offices and agencies. Now, Namibia, without further ado, please help me welcome my studio guest for this morning, which is Dr. Esperance Lovinto, the Minister of Health and Social Service. Honorable Minister, good morning. Welcome to the Government Information Center. Happy to have you here.
Good morning. Thank you very much for having me. I'm excited to be here.
Thank you. You may proceed with your statement, please.
Good morning, dear moderator, distinguished invited guests here at the Government Information and Communication Center, everybody that is present without watching online and has taken the time to join us. We appreciate it, and we are here to provide a bit more information to the public at large. I am honored to be here with you all for the very first time in my capacity as the Minister of Health and Social Services to engage in dialogue about health, as well as to offer a sense of transparency, which is important, particularly a sense of accountability, especially when dealing with the lives of the Namibian people. Today, I want us to focus on fundamental principles that guide our work at the Ministry of Health and Social Services, that guides our day-to-day activities, as well as initiatives aimed at strengthening the healthcare system of Namibia. Primarily, I would like to start by focusing on the mandate, the vision, as well as the mission of the ministry as a foundation in order to highlight why we do what we do and why we are focusing on what we are focusing on for the future. Primarily, our mandate, and this must be clearly understood by all Namibians in order to understand the work that we do. The mandate, and I will repeat, is to oversee and regulate public, private, and non-governmental sectors in the provision of quality health and social services, ensuring quality, accessibility, affordability, and sustainability. Now that is important because oftentimes it is misconstrued that the Ministry of Health and Social Services merely exists to regulate the public sector and not the private, and we must clarify that very importantly within our mandate. Our vision is world-class health for all, that we have repeated time and time again. Is this an aspirational vision? Yes. Is it possible? 100%. With the necessary steps and the necessary partners, it is possible to achieve this vision. Our mission is to provide comprehensive, accessible, integrated, equitable, timely, evidence-based, and high quality. I emphasize on the point high quality because our mission centers around the fact that our goal really is to provide quality standardized healthcare for all, irrespective of socioeconomic status. However, we highlight the word high quality as it is important that the quality of care offered to Namibians is standardized across the country. The importance of health system strengthening is one that I cannot emphasize enough. Oftentimes, we limit the Ministry of Health and Social Services to hospitals and clinics. Within those settings alone, it is important that I highlight that a health system is more than just hospitals and clinics. It is a complex network of interconnected components that must work together efficiently. And so, therefore, we exist in order to ensure that all of these components operate smoothly, and not merely the component of the clinic and the hospital, but also all interconnected and related aspects thereof. We focus on strengthening the 6 core building blocks of our health system, and these are service delivery, health workforce, health information systems, access to essential medicines, medical equipment and technologies, health financing, leadership, and governance. In the interest of time, allow me to elaborate on 2 of these building blocks, very critical. Firstly, service delivery. I emphasized very importantly the customer service charter that was launched by the ministry early March 2025 that stated the goals of the Ministry of Health and Social Services in terms of the service we want to offer. I repeat once again that we do understand that a lot must be done and a lot still needs to be done and is being done. However, we also highlight the fact that in order to attain the goals that we want to achieve, we must set these goals. Sometimes these goals can be scary because we ask ourselves how we will get from the waiting times we currently have to the waiting times that have been stated within our customer service charter. And although very bold statements, I echo them and I stand by them. The customer service charter indeed states some of the key parts of which we are hoping, and not just hoping, but that we are working hard to achieve. We must not be limited by the service delivery of previous years, and we must not be limited by the previous limitations. However, we must ensure that we are guided by where we want to get to and work towards that. To date, the ministry has 291 clinics, 40 health centers, 27 district hospitals, and 5 referral hospitals, including 1 national referral hospital. A key achievement has been improving access to healthcare facilities, ensuring that about 80% of Namibians now live within 10-kilometer radius of healthcare facilities. Is this enough? No. We understand full well that in order for this quality healthcare to be standardized, we should be stating that 100% of Namibians live within 10-kilometer radius of a healthcare facility, and that means decentralizing healthcare that we are working very hard to do. Namibia has implemented a national health programs targeting specific diseases such as HIV and AIDS, tuberculosis, malaria, and others, with significant success in reducing their prevalence. Furthermore, significant strides have been made in improving maternal and child health services through increasing access to antenatal care, skilled birth attendance, and postnatal care. We emphasized it in one of my first visits in the regions when I went to Katima Mulilo Hospital, and I stated very clearly that our maternal and neonatal mortality rates, we are working very hard to ensure that we meet the targets. We do not want a mother or a baby newborn to die of preventable causes. And here we must work together and take it far from just statements to action, ensuring that the workforce that we have delivered in instances that cater for the mother and the baby are well trained in order to provide care to both the mother and the infant in order to prevent the loss of life. This we must take very seriously, as losing a mother or losing a neonate is not one that we must take lightly. We are proud to announce that Namibia has been certified as a silver tier for being on the path to elimination of mother-to-child transmission of hepatitis B and has achieved bronze tier certification for being on the path to elimination of mother-to-child transmission of HIV. I also wish very importantly to state there, as has been highlighted on numerous occasions regarding the achievements of the Ministry of Health and Social Services of the 95-95-95 target, that we have well exceeded that and now stand at 96-98-98. And with that said, it speaks to the achievements that have been made and the strides that have been made, although still highlighting work that must be done, emphasizing on the fact that these goals and these achievements, as I emphasized to my executive team in a meeting very recently, that these only highlight the fact that we have now identified a percentage of Namibians that are positive. We have ensured that they are on treatment, and we have ensured that they are not detectable in terms of viral load. However, it does not in any way emphasize the fact that we are still having new cases that are being contracted and that are being reported. And that speaks to the fact that more education must be done, that although we have the treatment for HIV and although we are treating it, ensuring that people are able to get to below detectable rates of viral load, we must also emphasize that we do not want more cases. We want to protect our young people against contracting the virus, and that must be emphasized along with highlighting our achievements. These certifications highlight the profound impact and the profound strides that the Ministry of Health and Social Services, together with key partners and stakeholders, has been able to achieve. Based on the World Health Organization, the Service Coverage Index for Namibia achieved a universal health coverage of 63% by 2021, improving from just 39% in the year 2000. High access to and the use of service have resulted in visible improvements. And once again, I continue to emphasize that although we have made these great strides, it in any way does not limit us to state that we have done enough. However, it motivates us that we must continue to push in order to ensure that we meet our targets in the future coming years. Life expectancy in the country has improved significantly to 64 years in 2009 compared to 60.9 years in the year 2010. And this is important as it highlights how our people and the Namibian people and their health is being preserved in order to ensure life. To ensure that our healthcare system is responsive to the evolving health needs of the Namibian population, we have recently revised our essential package of health services. And I wish to highlight that this revised package includes a broader range of services with a greater focus on preventative care. And I want to highlight the importance thereof. Prevention has often been highlighted as being better than a cure, but oftentimes we don't talk about why that is the case. We have spoken about health financing in the previous months, and as we debated the budget, we very importantly highlighted that healthcare is a very costly exercise, and the cost of prevention, as opposed to the cost of curing and treatment, must be emphasized to the public. It is time we start focusing on preventing diabetes as opposed to focusing on treatment and management alone. By focusing on prevention, we can actively ensure that we reduce the costs that we spend on the treatment and management of these diseases. While significant strides have been made in universal health access, we definitely understand and we agree that gaps remain in service quality and equity. Priority areas include gaps in quality of care, inequalities in accessing quality care, gaps in the coverage of health services, and then sustainability and adequacy of domestic public sector funding. With that, I wish to highlight that it is critical that as Namibia has continued to highlight regarding the Abuja Declaration, it is important that our country meets this declaration, ensuring that we spend at least 15% of our budget on health care. Regarding the health workforce, a topic that is key and central to the functioning of any health system, the Ministry of Health and Social Services recognizes that health and care workers are the biggest asset and often undervalued commodity of the public healthcare system. And I've highlighted time and time again that we do not have a health system without our healthcare workers. And mind you, this is not only limited to doctors and nurses, as is oftentimes highlighted. Healthcare workers include many, including our technologists, lab technologists, our pharmacists, our potters, our hygiene officers, not referred to as cleaners, and all that form a very important part of the work that we do as a ministry. Recognizing, however, the critical need to strengthen our health workforce, the government of Namibia has approved a significant expansion of our staff establishment with the creation of 11,742 new positions earmarked to be filled. This brings the new total approved staff establishment of the ministry to 31,408 positions. However, despite this achievement, the reality is currently only 50% of these approved positions are filled. That highlights the fact that we are currently functioning at about 50% only staff complement, which definitely imposes a significant challenge and impact on the ground. It leads to increased workload for existing staff, longer waiting time for patients, reduced quality of care, uneven distribution of services. I wish to highlight at this point that these are all points that we are well aware of as a ministry. We are working hard to ensure that in times where there are budget limitations, we are able to be creative and innovative and try to sit around the table to come up with possible solutions to ensure that we can meet the demands of the people, as that is why we are there, to serve and ensure that we serve well. Regrettably, the ministry has not yet received the necessary funding to fill these key positions. However, we are actively exploring various avenues to secure the necessary funding to address these critical shortfalls. I wish to emphasize once again that we understand that a ministry cannot function effectively and efficiently without the necessary staffing, as it is the staff that cater to the needs of the people. And this is a top priority for the entire ministry, including the executive team. Moreover, the ministry is committed to investing in the professional development of our staff. Through our fellowship program, we have been supporting healthcare professionals to pursue advanced studies and specialized training in various fields. I continue to highlight the need for upskilling our staff, the need to ensure that there is career progression, the need to ensure that nurses particularly get the necessary recognition when they have taken the time to upskill, ensuring that we make room for specialist nurses, amongst others, in the fields of mental health, critical care, pediatrics, as well as nurse practitioners, which is an aspect of training and qualification that has been well received all over the world. Mind you, nurse practitioners are able, through research, and research has proven that nurse practitioners are able to do about 70 to 80% of what a general practitioner is able to do in terms of scope of practice. So by upskilling our people, this would drastically allow us to decentralize, ensuring that patients do not have to wait long hours to only be seen by a doctor, when some of these services can be delegated to other staff that have been upskilled as necessary. The importance of health literacy is one that I wish to highlight very importantly. I want to emphasize the critical role of health literacy in promoting good health and preventing disease. Health literacy is not only for healthcare workers. We continue to emphasize this as a backbone of the public healthcare system in this country. I highlighted and continue to highlight that we must promote an approach that speaks to the fact that we are all our brothers' keepers. When it comes to healthcare, we are not expecting that every Namibian knows everything or is at the level of a nurse or a doctor. However, we are hoping that we can promote an approach to ensure that we all are able to pick up abnormalities, even if it is for a grandmother or uncle that is staying in the village or the rural area, when they communicate with us and they highlight things such as the fact that they are on medication for diabetes and they have been having blurry or disturbed vision, or in times where people with mental health conditions or mental health illnesses highlight to us from sometimes distant areas and environments, when they highlight to us the fact that they have been possibly hearing or seeing things that are not there. It is important for us to have in mind and have basic information and health literacy to be able to understand. We might not know the diagnosis, but to be able to point out that something is wrong and your family member, your relative, your friend, or your neighbor must be referred to a local hospital immediately. In Namibia, as in many other countries, health literacy levels are suboptimal, especially in rural settings. This can lead to poor health outcomes, as people may not understand quite how to prevent disease, manage chronic conditions, or access healthcare services. I believe that every Namibian should be empowered with factual health information in order to make informed decisions about their health. Developing and implementing health education programs that are tailored to the needs of different communities is key. It is important for us to recognize that a one-size-fits-all approach is no longer the approach that we can take, particularly when it comes to healthcare. We must educate our people in a language that they understand. It is not mandated that people in all areas must speak English, and therefore our health education must communicate such. When we educate people, including about the HPV vaccine, amongst others, we must educate them in a language that they understand. We must meet our people at their point of need. Using a variety of communication tools and channels such as radio, televisions, platforms like these are very important to ensure that we meet our people at their point of need. Training healthcare professionals to communicate effectively with patients and to provide them with the information that they need in order to make informed decisions is key. We have oftentimes heard lamenting from patients, stating that sometimes they are given medication, they are not educated, they are simply sent away. That is problematic and one that we must deal with as a matter of urgency. Our healthcare workers, including nurses, doctors, pharmacists, assistants within the hospitals, must ensure that as soon as a patient leaves the hospital, they have the necessary information, be it about the condition that they have or about other health-related matters that they may have questions about. Promoting health literacy in schools and workplaces, we are working very hard together with our stakeholders such as the Ministry of Education, Innovation, Sports, Youth, Arts and Culture, as well as other stakeholders to ensure that we are able to, in the future, integrate health literacy into our curriculum. This is important. We should not be learning about a lot of these health principles, PEP, PrEP, vaccines, and others after we have finished school and we've graduated. These are basic principles that help combat misinformation. Furthermore, I wish to highlight, as I draw near the end, the importance of community health workers. We have highlighted time and time again the importance of decentralization, and time again we've received questions as to how the ministry intends to do this. Community health workers is not new to the ministry. We have raised over 1,000 community health workers already. My target when I joined the office and I was speaking to the team responsible for primary health care, I gave them a very bold target and one by which I stand by. We must target to raise at least 10,000 community health workers in order to dispatch them into the communities to ensure that we cater to the needs of the people where they are. Long gone are the days where people must travel in order for them to receive the necessary care and attention. I also wish to highlight there the importance of health posts, which is a topic that was introduced by the previous Minister of Health, Honorable, who emphasized the importance of raising and creating health posts in order to ensure that these are manned by community health workers that can do the basics, in order to ensure that none of these people, or a limited number, are required to be sent or referred to centralized health care. I wish to highlight, as I end, the issue of misinformation in healthcare. This is one of our biggest challenges. It is one of the biggest issues and the most critical issues that we face as a ministry. Promoting health literacy is important, as it combats the spread of misinformation. We have witnessed how misinformation campaigns can undermine public trust in science and lead to lower vaccination rates, amongst others, not only limited to vaccination. It is our collective responsibility to combat these harmful narratives. I wish to use this as an opportunity to highlight for a lot of us who have undertaken postgraduate studies and have done masters, for example, when we research, we are often limited in terms of the research papers we can use. We are told we can only use research papers that were published between a certain time. We are told that we must check where they are published, how they are published, and we are told to confirm the validity of these research papers. But oftentimes, this is not the approach with which we address misinformation in healthcare, and this is troubling. It is troubling because there is misinformation that goes around that oftentimes creates a narrative not based on research, but based on sometimes a tweet or based on a Facebook post. And this is problematic. Vaccines at this point, I wish to highlight, are one of the most effective tools we have to prevent infectious diseases. They have existed. The same vaccines that we give our children against polio, against measles, against all of these diseases that we have seen been done away with because of these vaccines is the same approach that we wish to take. We embrace open, transparent conversation. Even with the issue of the HPV vaccine in preventing cervical cancer. As we know, cervical cancer is a leading cause of death amongst women in Namibia. However, it is still a largely debated topic. It is sad to note that it is a preventable disease, yet one that we continue to diagnose people with. I also wish to highlight, as I highlighted on TV a few days ago during a live interview, stating that it is important for us to understand that cervical cancer is still largely a disease of inequality. A lot of the times, the people that debate on this issue are the ones sitting in the towns and the cities, and those that are oftentimes largely affected are the ones in the rural areas. And they are affected largely by the misinformation and unable to make decisions for themselves. On that, I wish to highlight again very publicly that no vaccine, no immunization is mandatory. We provide the necessary information and then allow that the necessary people, including parents and women, are able to take the decision that they feel is best for themselves, taking into consideration the information, the research-based scientific information that has been provided. In conclusion, the Ministry of Health and Social Services is committed to strengthening our health system and improving the health outcomes for people all over Namibia. We will continue to work diligently to implement our mandate, to achieve our vision, and to fulfill our mission. We will prioritize strengthening the 6 building blocks of our health system, promoting health literacy and combating misinformation. We recognize that we cannot do this alone. We need the support of all of our stakeholders. We recognize the importance of the people that have partnered with us to date, and we ask, let us work collectively to achieve the health and the world-class health for all people in Namibia that I continue to emphasize we all want. I thank you.
Thank you so much. Thank you so much, Honorable Minister, for delivering that comprehensive update and for updating the Namibian nation on matters pertaining projects, programs, policy formulations and advancements, but also strategic implementations within your ministry. Indeed, we highly appreciate your time this morning, and we especially wish you all the best, especially as you navigate through these complexities that our health sector is faced with at the moment. And you can, of course, count on us to disseminate information to the public as it may be needed. Thank you so much. Now, Namibia, that concludes our briefing session this morning from the Government Information Center. You have been with me, Hilani Philippa. From all of us in the studio, it's goodbye. Take care.